Okay, great. Why don't we go ahead to the next slide? Welcome, everyone, to today's Connecting for Better Health meeting. If this is your first ever time joining our coalition, we start every meeting with our vision and our policy priorities. The vision of this coalition is that every Californian and their care teams have the information and insights they need to make care seamless, high quality, and affordable. We have 4 policy priorities for 2025 that are listed here. First, establishing DXF governance and accountability. Second, identifying dedicated and sustained funding streams. Third, strengthening social services data sharing. And fourth, advancing high quality and actionable data sharing. It's great to see everyone joining. It looks like we still have a number of folks coming in from the waiting room. As always, we'd love if you can introduce yourself and your organization in the chat. Helps everyone get a sense of who is all with us today. We can go ahead to the next slide. Our agenda for today, we're going to start off hearing from our partners at Civitas about their upcoming annual conference. We also have Rim Cothran from the HCI DXF team here with us today to talk a little bit about recent activities at the Technical Advisory Committee. We have a number of really excited California and federal policy updates. Senate Bill 660, authored by Senator Menjivar, is headed to the governor's desk. We'll talk about that, as well as the Rural Health Transformation Fund survey, which closes tomorrow. And a few other developments coming out of the federal government. So exciting updates today. Thank you again all for spending your hour with us. With that, I think we can go ahead to our next slide, and I'm going to introduce Jolie Rizzo. Many of you know Jolie, the interim CEO of Civitas Networks for Health. Jolie, thank you so much for being here today. We're really excited to see you at the end of the month, as I'm sure many folks are traveling to Anaheim for the conference, and we'll hand it over to you.
Wonderful. Thanks so much for having me. Yeah, I can't wait to see all of you. We're just about at 700 attendees right now, and every year it's always really fun in the last few weeks to watch the numbers just continue to rise. So delighted to be hosting in California this year. We have a lot of members in California, so it's a great opportunity to bring our community together. So hi, everyone. I'm going to just talk a little bit about the annual conference and share some information about our event. All right. So as I just said, registration is still open and our numbers are continuing to climb. We definitely expect over 700 at this point. And we bring together people from all over the country that are working on health information exchange, working on both sort of local, state, and national interoperability. Many of our Civitas members are what we refer to as regional health improvement collaboratives or quality improvement organizations. And we have, affiliate members that lead groups much like this, Connecting for Better Health. And it's just a great opportunity for us to bring folks together that are passionate about using data to improve care, to improve health. And we think that that is critically important. So the conversations will all be tailored to that. The theme is bridging data and doing. Our logo, as you can see, is the bear. We refer to her as Bridget. She's become our mascot, and she's helping us to bridge data and doing. I've got my t-shirt on, and I'll talk a little bit more about the shirts in just a minute. But we are this year in partnership with 211 San Diego CIE, as well as many of our other California members. And they formed our host committee and have been informing the event design and bringing some of that, local flavor to a national event. All right, and InterSystems is here because they are our platinum sponsor this year, but we have many other sponsors that help to make our event possible. Jump to the next slide. So I'm going to highlight just a couple of keynote speakers here. We actually have quite a few more, but we do bring esteemed speakers to both the main stage and then have plenty of sessions throughout the 3 days that we bring people together. I am personally very excited about hosting a fireside chat with Dr. Teresa Cullen, who's the public health director of Pima County in Arizona, and has just an incredible resume and honestly just her experience of being with Indian Health Services for 27 years, having done work in the VA, having worked for the federal government, having deployed to West Africa. It's just, I'm really delighted to have a conversation with her. She brings really important insight, I think, at a pretty critical time. But she is both a practicing physician and also an informaticist. So excited for that conversation. That's going to happen Sunday at the conference. And then we also, one of our host committee members encouraged us to invite Dr. David Hayes Bautista, who's a professor of medicine and the director of the Center for the Study of Latino Health and Culture at UCLA. And I think he, in talking with him just a few weeks ago, is going to bring forward some really important perspective and research around illuminating and taking a deeper look at demographic trends and their implications for health equity and cultural responsive care. So those are just two of the keynotes that we're excited about. One thing I wanted to mention on this call, because it's relevant to all of you, is we are going to also have a keynote panel on Monday at the conference in partnership with 211 San Diego, but also with HCI. And their chief medical officer will help to moderate the panel. And we have some other leaders from California, two of which are Civitas members, Bill York with 211 San Diego, and then John Helvey with Sac Valley MedShare. And they both are QHIOs and involved with the data exchange framework. And with the shift for the DXF sitting under HCI, they want to have this conversation be a little bit more about listening and not just telling. So excited for that conversation to happen at the event. And then they actually are planning to host later that day a listening session for attendees to continue to gather more information for those of you that are in California and also from partners outside of the state. And then on Tuesday, we also are going to have an important conversation around the future of interoperability. And that is going to be moderated by the former CEO of Civitas, Lisa Berry, who is a national expert on interoperability. And we'll have Ryan Howells, who's been really involved with the movement for the CMS aligned networks, as well as some other experts. I think we're going to have somebody from the senior leadership of CDC on that panel, just working out some final details. So we can move to the next slide. I would just encourage if you are attending or you're thinking about attending, please be sure to check out the agenda. We have 3 tracks. So the first track is really around how we use technology and continue to sort of inspire innovation. So that's where you'll see most of the conversations around sort of, efforts that are informing national interoperability, where we'll also be talking about use of AI and so on. The Promising Partnerships track is really just that, featuring how to have inspired and effective partnerships. And then the third track is the one that 211 is designing on community information exchange. And they have 13 sessions that should be pretty fantastic. Overall, we have 65 sessions happening over the course of the 3 days. And those formats vary between keynotes, workshops, roundtable discussions, lightning talks, and more. The goal of Civitas is to cut down a little bit at talking at people and providing space for just meaningful conversations to happen. We try to make a fair bit of space for networking. And it's really fun for both sort of the members of Civitas, but the broader community to be together and roll up our sleeves and talk about both what's working and what's not. All right, next slide. So we have been hosting a series of virtual pre-conference sessions, and I bring this up because We're actually, next week will be the last of the 5 that we've hosted. The one that's happening next week is future proofing and adapting to ensure privacy and security. And that is going to be in partnership with Civitas Members Direct Trust, and will feature the work of other Civitas members involved as well. But the other sessions that you're seeing here are also available on our website. So all of the pre-conference sessions were recorded, and you can access the recordings and slide decks. So if you see something here that's of interest, I know Cami and the team from 211 San Diego couldn't join today, but they did want us to let you all know that the session that took place on September 3rd, which focused on foundations of community information exchange and building community-driven systems for person-centered care, is available. And this year, we're really fortunate that J2 Interactive has been the pre-conference sponsor, so that we've been able to host these 5 events in building some excitement and energy leading up to our in-person event. All right, we can jump to the next slide. In case you're planning to join us or you're thinking about it now, we did extend our room block at the Marriott. So the room block does offer a nice discount. It allows you to stay right where the event is happening, and that will be open through September 15th. So again, if you are thinking about traveling to join the event, take advantage of that. And we can jump to the next slide. All right, I said I'd come back to the bear and this whole Wear the Bear campaign that we have going. So we're really excited. Each year we do fun shirts, both to kind of just, again, another fun thing to bring our community together. But part of what we do is we select a nonprofit in the area where we're hosting to raise money for. So this year we selected It's Bigger Than Us LA, which is a community-based nonprofit focused on advancing health equity, long-term recovery care, and resource access for underserved families in California. And so we've raised, I think, roughly, $1,000 or so at this point. Hopefully we'll continue to sell a few more shirts. But also, it should be really fun. On Monday at the conference, we're encouraging all our attendees that have purchased shirts to wear them so that we can get some group shots and just continue to sort of bring the community together around this. So. And they vary. So like I got my tie-dye on today, but I did also get a sweatshirt just because they're fun. So, all right, next slide. Another fun thing about the conference, so each year we host our Community Excellence Awards. And this is an opportunity for us to shout out remarkable individuals and organizations that are making positive contributions in their communities. And so we will be doing this Monday evening, right before our gold sponsor reception. And I'm so excited this year. We have 12 winners. We had a couple categories where there were, in fact, ties. And our judges, after careful review, just said they're both deserved kind of thing. So anyway, if you're coming to the event, please join us and help us celebrate the achievements of those who are going to win the awards. All right. So I think that brings me to the end of the updates I wanted to share with this group. If you have any questions about Civitas and our event and or just who we are as an organization, don't hesitate to reach out to us. We're always happy to take questions. Did I cover everything, Stephanie? Anything else?
Absolutely. No, that was great. Thank you so much, Jolie. Really appreciate you being here today. Up on here, just a smattering of the many C4BH partners and coalition members who will be speaking at the conference. We know there are more. I'm sure there's more, but just did a quick review of the agenda. You can see so many of our amazing partners that we interact with virtually twice a month here on stage at Civitas. But I'll pause for a moment. Any questions for Jolie about the conference? Okay, well, we can move to our next slide. Jolie, thank you again for coming today and sharing this
Thanks
information.
for having me.
Yeah, and Timmy, I'll hand it over to you. You want to talk a little bit about meeting up at Civitas?
Yeah, well, it wouldn't be a conference without us sponsoring a meetup. So we're really excited. Please, everyone, mark on your calendars. If you're joining the conference or if you're not joining the conference and you're local, please stop by 6:30 on Sunday, and we will be right there at the Marriott. So super easy. We'll see you. You'll see us. And like Jolie said, this is an opportunity for us to see each other in person. And that's, of course, I truly believe that's where the magic happens. So if we can get together, let's do it. So we look forward to it. Thanks, Julie, for the opportunity.
We're so excited to see many of you in person.
I'm
Okay.
truly I'm so delighted. It's so funny. When we formed Civitas in 21, I had just started working with Lisa, but wasn't new to, had been with the Network for Regional Healthcare Improvement and part of the design of Civitas. And I said to her, I said, I'll do anything. I just don't want to have to lead the annual conference. And she was like, you're going to lead the annual conference. But I have come to love this event truly. And I think it's because how much the community loves coming to this event. It really is fun. So it's like a full 180 and I genuinely I'm ready to pack my bags now. I'm that excited about it.
Awesome.
Great. We can move ahead to our next section of the agenda. But again, just thank you, Jolie, and so excited to see you. I'm next going to turn it over to Rim Cothran, Consultant and Technical Advisory Committee Chair, the HCI DXF team. And Rim's going to provide us with an update on the Technical Advisory Committee. They're currently in the midst of the Event Notification Architecture Focus Group Series. So Rim, thank you so much for being here today. I'll hand it to you.
Well, thank you for having me here today as well. The current series on event notification really is the most recent in a number of events, number of activities surrounding event notification. It began with a task series in 2024, where we talked about uh, larger concepts and how we might organize event notification. We also convened the 2024 Standards Committee for recommendations on events and notifications, as well as rosters, some of which made it into a proposed amendment of the technical requirements for Exchange P&P, specifically designed to update what we were doing on event notification. Many of you may have participated in the public comment on that proposed amendment, and that's something that we're still deliberating internally now. Then the event notification hack series that we're in the middle of now is our most recent public event. It's a series of public meetings. You're all invited to listen in on the discussions and participate through Q&A or public comment at those meetings. Next Thursday will be our fourth and final scheduled meeting, if we don't convene a fifth in this series, on event notification. Just a little bit about the tax series this year. Many of you participated, I think, as members of the public, and some of you as members of the TAC meetings themselves on social services in our initial series this year. I see that Sophia is attending today's meeting and did a great deal in moving social services and that agenda forward during that time. Thank you all for that. Then on consent management, and our final series will be on identity management coming up later on in this year. All of those, none of those can actually be taken just in a vacuum. And so we will be considering input from all of those series and all of those experts in trying to knit together a picture of how we advance DXF. Many of you have been very vocal in saying that we need to address identity if we're going to do events. Absolutely, we do. And we need to address consent if we're going to do events. And that's also true. And so we're hearing from experts in all three of those fields, but we'll be, again, trying to knit all of that together in upcoming activities. A couple of things that I'd really ask that people think about in the coming weeks. So next week, as I said, is our final scheduled meeting with the TAC on event notification. We've been getting a lot of good input from the TAC members so far. We've been talking about what do intermediaries look like? What are their responsibilities? How do requests for events move around? What needs to be included in a request for events? And what do notifications need to look like, and who is responsible for notifications? We've talked a little bit about how consent figures into that picture. We talked about the priorities. We've touched a little bit on sustainability. We've talked quite a bit about privacy, and what we're planning in our next meeting is to start to knit together all of the different recommendations and characteristics of an architecture that we've heard and propose something that might be the focus of how we move things forward. So I'm really hoping for a really interesting meeting next week. Our intent is get the slides for that meeting out a little earlier than we do for most of our meetings so that members of the public can take a look at things too and engage in those meetings. We've enjoyed in the past some really good public input into those meetings, and I love to see that. I really encourage people to participate as members of the public, either through the Q&A that we get during the meeting or in public comment in a public comment period. So please look for that coming up. The other thing is that, as I said before, we've been considering public comments on the technical requirements for exchange. And most of that amendment was targeted at advancing event notification. We're going to be talking about that at the upcoming IAC meeting on the 28th. I know, Stephanie, you didn't ask me to talk about the IAC meeting, but I'm going to anyway. That's what happens when you give me the mic. And in particular, there was some public comment that we received on event notifications that we're going to be bringing to the IAC for discussion. We got a lot of good public comment there. There were 10 organizations, over 90 separate comments on that, many of them targeted at things we're going to adopt as improvements to the language, but some things where there was real disagreement in the public comment and things that we've heard from other advisory committees that we're going to bring back to the IAC for discussions. That's on SNF's involvement in admissions and discharge notifications, on human readable content, and on how rosters are managed. So look forward to people listening into that discussion, and there's going to be public comment at the IAC meeting as there is at all of our meetings there as well. So I really invite people to participate there.
Rim, could you just clarify? So you received some input, and so those areas are going to be part of the IAC. Are you looking for solutioning, or what's the intent of the discussion?
So the IAC is an advisory group, so we're looking for advice on some of the questions that the public comment raised in our own minds about priorities, requirements, maturity of the industry, et cetera.
And are those already out or published? As we
No.
should know this. Okay.
No, and it's one of the things that we're going to be looking to get those materials out in advance of the meeting as well, so that people can take a look at what is getting discussed there. I just thought I would selfishly use this forum to start getting that message out.
Yeah, no, that's great. Thank you.
Thanks so much, Rim. Yeah, and
that's
we'll
what I
make
wanted to
sure.
bring here. I don't know if you had any other questions or comments from me, or if any of your members want to ask a question.
I think there's a really great question from Dr. Lossie in the chat just around defining event notification. Do you want to speak to that for a moment, and also just talk about the sort of shifting focus on the term event notifications?
Sure. So what the prior policy and procedure identified for what we're now calling event notification was notifications of ADT events. So first of all, ADTs focused very much on a particular technical standard, and so we want to get away from that, but it's also very selfishly focused on a particular medical event, that is an admission or a discharge to an acute care facility. And so what we're trying to do is, first of all, adjust our language to thinking more broadly about events that impact an individual's health and well-being. And we are starting off by limiting those requirements still to admissions and discharges to hospitals, emergency departments, and under consideration in this amendment to skilled nursing facilities. But the idea is that those events might expand to other events as well. Might be an encounter with the medical system, such as me actually going to a specialist. Might include non-medical events, such as me gaining or losing eligibility for Medicaid, or me being released from incarceration, that might be useful for other organizations and other individuals that are participating in my overall healthcare care to be informed of. So we're setting the stage for a broader type of event. And part of the discussion we've been having with the TAC, we've tried to focus outside of just admissions and discharges to acute care facilities. And if you look at the TAC membership we have, it includes a large number of specialists and other organizations, including social services and county support, not just the healthcare sector.
Thanks, Rem. I do know we have a number of organizations and individuals on the call today who have sat on these TAC focus groups, both event notifications, but also the prior ones. Anyone on the line today who's been part of these committee meetings want to share any reflections or thoughts ahead of this fourth and final event notifications focus group next week?
Hello, this is Gavik. I don't know, can you guys hear me?
Hi, Gavik. Yes.
Yeah, I've been part of, I think, the most prominently the consent management one. Reem and team have done a great job on that one. I suppose one reflection is, and one thought I have or question really is, how's it all going to come together? Because as those meetings and sessions were ending, there was still very divergent opinions as to how things need to be consolidated. And they were all great opinions. So it's not like one was better than the other, but they're divergent. And so the question is, my question to you, Reem, and those committees are, how are we who are not sitting in those going to see progress towards consolidation of those? And I know you have a hard job. It's not easy to make everybody happy, but things need to get done. So we would love to help. The public would love to help as best as we can. Thank you.
Well, thank you for that. And yes, I do appreciate your participation in those meetings and continued participation as a member of the public. Gavik does call into public comment periodically, and I appreciate that. As you say, there are some times when we reach consensus on a recommendation at those TAC meetings, and there are some times when there are important but diverging opinions on some of the topics. I think that over time, we're hoping that we mature to a set of consensus recommendations that allow us to move forward. But in the meantime, we're trying to move forward on those recommendations where we have reached some consensus. We're also looking at ability to combine what we're hearing in consent, what we are currently hearing in event notification, what we will hear in identity, and how we crosswalk those as well. I'm always interested in individuals either from these meetings in this community or elsewhere to give me more input outside of those meetings. There are many more activities that we undertake. Those are the public meetings that everybody has some visibility in. But you're going to be seeing TAC meetings, I believe, beginning in 2026, where we will gather some of these same topics and see if we can advance over time some of the areas where we don't reach consensus. So yes, this is a hard job. We're not going to get everybody on the same page immediately, but we're trying to continue to move the ball forward through discussions with our stakeholders. Thanks for your patience in moving this forward.
Thanks, Rem. And I see a comment from Michael. Michael, you want to hop in with TAC thoughts?
Yeah, I mean, I think that, one of the things that is challenging for our group is the variety of participants and constituents interested in sharing information and what information is or isn't appropriate to be shared. So I'm the director of applications and responsible for interoperability for Sutter Health. And so as you look at the participants in DXF, is a notification of an admission to an emergency department appropriate for a social services organization, and what information in that is appropriate. And I think, talk about members of the public or community commenting. One of the things that is a challenge as a covered entity, we have responsibilities to protect the patient confidentiality and what data does get released and who's it gets released to and how it gets released. And so some of the challenges are, as we work with organizations that are and are not covered entities, what data can and can't be exchanged or shouldn't be exchanged, what's covered under particular legal, parameters. Again, I'm not a policy wonk, so I'm not super deep in the weeds there, but I understand enough, having done this for years, to know that we need to ensure protection, confidentiality, consent, things of that nature. That's what makes this probably more challenging than some of the other things that we've done. I participate nationally on a number of national organizations that do health exchange. And even for those organizations, finding the right balance between making data as liquid as possible and available to as many as possible, while also protecting it and ensuring participants are appropriate participants receiving the right information. And those networks are mostly set up for treatment-based exchange. DXF includes treatment, but operations, payment, public health. Again, there are other, I know I'm not quoting it correctly, so don't hold me to those words, but I know, but essentially we're looking to expand that past a treatment specific use case. And so those sorts of things make that more challenging. And I think that ensuring we have the right security parameters, consent, and technology in place to allow people to participate, but also protecting and provide that confidentiality and security to those whose data is being exchanged is critical. And that's the biggest challenge I see from what the work we've done so far.
Thanks, Michael. And if I could just speak on that for a minute, I know, Stephanie, I'm getting over time here, but I think Michael really did identify one of the challenges that we have with the TAC and with DXF in general. We're trying to raise the bar here beyond what some of the nationwide networks are already doing well and include other sectors that are responsible for whole person health, as well as other transactions beyond just treatment. And that is where we really run into some of the difficulties that Michael's talking about. One of the things that's emerging, for instance, in event notification is there a need to almost set up separate networks for social services and for healthcare, something that I'm allergic to. It sounds like setting up yet another stovepipe, but how do you allow different sectors at different areas of maturity to still advance things without everybody standing back and saying, this doesn't sound right, doesn't feel secure, doesn't feel like I'm protecting privacy appropriately and not participating at all. So it's a very difficult path to walk. And I think we're going to have a really interesting meeting next week. So thank you.
And if I could jump in, and I couldn't help myself, but Michael and Rim, as you're describing these different sectors coming together, that's exactly what we've been doing in our design studios with Connecting for Better Health, is bringing organizations and their partners, just deciding on a single use case with a persona and with a person in the center, and then looking at how the data needs to flow to be able to support that journey. And we have, I think, over 11 different use cases right now that we've been defining with multiple different organizations. And it really highlights how important the ADT work is. So all you need to do is log in. It's password protected right now, but you can just create your own password. And we're here to answer any of your questions, but it's a great launching spot.
Well,
And
thank you for giving me a piece of
Oh.
your agenda today. I really appreciate it.
Thank you so much, Rem. So we have two upcoming dates on everyone's calendar: September 18th, final event notification TAC focus group, and then the IAC meeting on the 25th. We'll continue to send out these materials and reminders to the coalition. So hopefully as many people as possible can tune in. Thanks, Rem. Okay, let's move ahead into our policy and advocacy updates. We can head to the next slide. I know we have a lot of excitement and energy today as Senate Bill 660 passed both the Assembly floor and the Senate floor for concurrence just yesterday. So we're now headed to the governor's desk. This is a significant milestone for us as a coalition, for all of us who care about the efficacy and sustainability of the data exchange framework. Many of you provided insight, technical assistance, ideas, and recommendations over the last 3 years when this was originally under AB 130 or 1331 2 years ago. For both of those years with AB 1331, this, second House appropriations milestone was the major hurdle that we couldn't get beyond. So we're just really proud and so grateful to all of you that this bill is headed to the governor's desk. Now is the opportunity for organizations to share your support with the governor's office. We have a template letter that we'll be putting in the chat now with instructions on how to submit to the governor's ledge unit via email. Signatures can start happening any day from now through October 12th. So it's really crucial that those letters come in volume and come sooner rather than later. The governor's team is busy analyzing and assessing lots and lots of bills right now. We'll talk a little bit about the language in a moment, but I just want to also share, if anyone has never submitted a letter to the governor's office before or has some questions about the process or anything like that, we're here for you. Please reach out. Happy to help and support that process. But I do want to share that 660 is the product of hours and hours and hours of stakeholder engagement led by the Senate Health team, amendments based on feedback, concerns, much from all of you and others who aren't on today. And really, a lot of perseverance to move something this session that the greatest number of stakeholders could get behind. And a lot of that, we've been so thrilled and honored to work with Terry Boughton, who's the principal consultant to the Senate Health Committee on this effort. Terry, thank you so much for joining our meeting today. It's really amazing to have you here with us, and just would love to hand it over to you if there's any words that you want to offer around the importance of sharing organizational perspectives on this bill with the governor's office.
Yeah, thank you so much. I really have to just say thanks to Timmy and Stephanie and the whole Connecting for Better Health team. You guys were so helpful throughout the whole entire process, but in particular at the final negotiations, responding to questions and helping me think through issues. So, it was definitely a team effort. And I want to thank some of you on this call, on this meeting, and Max from Aliotos Health and Jason from Partners in Care for your support and testimony at the hearings, Robbie and Felix and others I know were very involved in helping us respond to questions and issues and thinking through strategy and amendments. So I just want to thank you all. It was great to get to this point. We have to get to the finish line, and Stephanie and Timmy have been great with putting together the template letter, and it is important to get it emailed in PDF form to the governor's office. I think they'd like you to focus on what problems the bill solves, some specific examples of how the bill will help. And if you can identify any potential impacts to the state budget that obviously would be relief and not costly, I think would also be helpful to focus on. And so thanks to all of you. And yeah, I think that's about all I have. I'm happy to answer any questions if I can. I know I saw some in the chat. So I'll stop there. Thanks.
Thanks, Terry. One question just on process. Is it important to CC you or Senator Menjivar's team in sending these letters to the governor?
It would be nice, but it's not necessary. But certainly, yeah, we would appreciate it. It's nice to hear. I mean, if it's just the template letter, then probably not as important, but it is nice to know how many letters are going out, and if there's some unique areas of focus that we should emphasize. I think that's helpful as well. We have had press interest in the bill, as you know, so hopefully there'll be more interest, and I know you all have done some social media as well, so I want to thank you for that.
Awesome. Thanks, Terry. Yeah, we'll put our email address in the chat for folks who want to CC us on that letter, and Terry, we can help collect all those for you. Great. Alrighty, so just to quickly walk through some of the amendments that came through the bill in the Assembly Appropriations Committee. That was about 2 weeks ago, maybe less than this. The revised version of SB 660, we'll put the link in the chat so you all can take a look at the bill text yourselves as well. Maintains the signatory definition clarity language that many amongst this coalition provided input on, adding EMS to the list of required signatories, clarifying the term provider organization and medical groups. 660 transfers the administration and oversight of the DXF to HCI in line with the Cal HHS reorganization that went into effect August 1st. This, of course, needed to be amended given the change happening August 1st when this bill was first introduced earlier this year in February, right? We didn't know about the transition to HCI. So 660 moves administration and oversight to HCI. SB 660 requires executing the data sharing agreement as a requirement for contracting with DHCS, Covered California, and CalPERS beginning July 1st, 2026. As we know, and we've heard from some of these department teams and spoke about it, especially at the DXF Summit in March, but in other conversations as well. This is happening in many places already, and this is looking to codify what's in practice around contracting language. And then it also requires HCI to submit a report to the legislature by July 1st, 2027 that includes a list of all entities who are required signatories, their status and their compliance pathway, an evaluation of the need for a governing board, enforcement, and investigation of disputes. So I know there's some questions in the chat around enforcement. Want to clarify that this amended version of Senate Bill 660 in this latest round of the language that went through in Assembly Appropriations provides HCI with the authority to develop enforcement actions and says that they may develop enforcement actions after the submission of that report in July 2027, upon budget appropriation and upon development of regulations. So those pieces would have to happen first before HCI can develop further enforcement actions. Okay, I'm pausing.
Stephanie, there's
yeah.
Melissa asked if there's any opposed that we know of right now.
On the Assembly floor, we were shared California Hospital Association opposition letter. That's the only opposition that we know of at this point. I haven't heard anything around governor's communication.
Point Click Care also was opposed.
Thanks, Terry.
Mm-hmm.
You happen to know why? That one's curious to me.
Which one? Point Click Care?
Yeah, I get the hospital one. There's not enough influence there, but not the PCC one. That this would benefit them in a lot of ways. Any idea why?
They seem to want a delay in any compliance requirements. I think the codification of the signing of contracts with DHCS on behalf of the skilled nursing facilities, I think that was of concern to them, even though that's already a contract requirement. I think that they were arguing for a delay in any kind of enforcement until after the nursing homes were able to negotiate new rates with the Department of Healthcare Services.
Thank you.
Jonathan, happy to follow up via email too with any supportive materials or explainers that would be helpful to you in speaking with EMS agencies. We can connect on that via email.
That sounds great. Can I ask a real quick question? It may not be a question. I just want to put it out there for if we can sort of preface the conversation. So I'm getting questions about the compliance requirement. So obviously there's a lot in here about regulation, governance, compliance, et cetera. Everything that I'm seeing, which is not really explicit, some of it's about the creation of a board to do governance. So I get that it's kind of kicked the can a little bit. Some of it is around information blocking and kind of aligning with the federal rules around that. But a lot of that seems to be inference. Like we're not seeing specific mention of if an EMS fire services are now required, but they basically say, come and get me. Which not a lot of folks do it that way, but they kind of say, we'll wait until the end, or, wait until there's a stick. What's the stick? We haven't been able to figure that out. And if the answer is it hasn't been defined yet, that's okay too. But certainly information blocking now provides quite a bit of stick. Just the last couple of weeks, right? There's a lot of words coming out of the feds around enforcement. So is it true that the state is going to sort of say we're going to do what they're doing and enforce using an information blocking premise, or do we have something else in mind? Thanks. I can't imagine I'm the only one with that question. Just put it out there.
I don't think we can answer all of that right now, Jonathan, but in terms of what's in the bill right now, right, is this contracting requirement that would go into effect July 1st, and this report to the legislature by July 2027 that would include list of required signatories and their compliance.
I guess the only other thing is the naming of names.
Right. So it's, Jonathan, it's more so, I guess,
Shaming.
making transparent organizations who are not in compliance. Yes.
And that's okay.
It's a step forward. Hey,
Yes.
everyone, it's a good step forward.
It's actually a great step forward. So the way in my world, for example, fire services, municipalities in general don't want to be held out as non-compliant for a range of reasons. Private services who fall under this rule may have different views on that. In some cases, we are seeing, some of you got tagged by me yesterday on the San Francisco announcement of an HIE RFP that called out interoperability with EMS specifically. That's like manna from heaven in my world. That's a big deal that they put that language in the RFP. So I expect that won't be the first one, and places will get the memo that they need to participate. But other places will simply say, again, like, we don't really want to do anything until we're forced to. So the question would be, there's better and there's worse in every community. If some places don't care about being shamed because they're pretty bad to begin with, other places want to be fantastic. Is that it? If that's it, that's okay. Again, municipalities have their own compliance rules. But are we limited at this point to you will be called out and publicly shamed for being non-compliant? But for example, could your license be at risk? Or is that up to the individual county to say you can't operate here if you are non-compliant, and therefore it will eventually come back to roost?
I think, Jonathan, at this point, it's all to be determined,
Okay.
And I think we should all be focused on this report that HCI is going to pull together for the legislature. And I just want to note too that that's after the administration change, which I think is really helpful to be able to keep the work that we're doing and the work that HCI is doing in the limelight, So we all need to lean in on that, and stakeholders making sure that HCI is hearing us and developing the recommendations in the July timeframe.
Right, and to begin, I'm going to submit a letter. I think this is amazing. So, I mean, this is really just, I'm going to get these questions. So I want to either be able to say, here's an answer, or here's what we think, TBD on making it formal.
Well,
And
let's formalize that. And as anyone here has questions, or you're hearing questions from stakeholders, send them to us.
Yeah.
And we can compile an FAQ, to the best that we can. So let's do that.
Thanks.
All right. Thank you, Terry. Thank you for your leadership and Menjivar's leadership. We are really, really appreciative of your partnership.
Yes, thanks so much for joining us, Terry. Okay, coming up on the end of our time, we do want to spend a few moments on a really important survey that closes tomorrow that we hope folks have already submitted responses to or are thinking about doing in the next 24 hours. So I'm going to hand it over to Ben Kane on our team to talk through a little bit around the Rural Health Transformation Fund survey, which is open through tomorrow.
Yeah, thanks, Stephanie. So I think many folks in this group will remember us discussing the Rural Health Transformation Fund. So won't go into too much depth on the program itself, but feel free to reach out with questions. And then we also do have a great blog post up on the C4BH website if you want a quick overview of the program. But since we last talked, we do have a little bit more information from CMS. As a reminder, this is a $50 billion grant program coming out of HR1 with a very quick turnaround. So it's going to be doled out for the next 5 years, starting in 2026, $10 billion annually. And each state is going to have to apply and A, be approved by CMS, and B, there will be a discretionary piece where states will compete for a pot of funding. So what we now know from CMS is that they will any day now be releasing the notice of funding opportunity for all the things they're looking for states to apply. And then they'll be asking states to return those by early November. So as you can imagine, that means the state is going to move pretty quickly on their application. Next slide, Maya. So here's a little bit about HCI will be running the process for the state, and they have recently put out a survey to stakeholders. So that survey is seeking your feedback in shaping what will become the state's application to CMS. You can see down in the bottom left just a little snippet of what HCI is envisioning for that timeline, keeping in mind that early November submission date that CMS has. And then just wanted to call out here on the right, I took out a few of the questions within the survey, I think most relevant for this group related to technology. But then if you go one more slide, Maya. Here we include all the links to the survey. One thing I'll note, the survey is, you can't save it as you go. You need to fill it all out and apply all once. The good news is that there is a PDF with all the questions for you to take a look at, familiarize yourself with those and understand what you're going to be asked. And then they do provide some other resources. I'd note on their website, there's the link to the survey, but also a link to the recording of a webinar that the State Office of Rural Health put on last week. And then just close that, of course, the survey is closing tomorrow. They did not put out a specific time, but recommend you get it in before close of business, just in case they do end up closing it early. And then we'll pause there if anyone has any questions.
So we have 2 homework assignments. One is to write the letter to the governor, and 2 is to respond to the survey. I really hope with over 70 of us here that they get at least that type of representation from the coalition. So please take a look at it, fill it out. It would be really helpful to the state.
And share it. I think that the state has had to move so quickly here. There's lots of email blasts and announcements going out, but we can all do our part to share it with more stakeholders as well. Your networks, your partners. One thing I'll flag just that definitely jumped out at me in looking through the survey, there are 2 explicit questions focused on maternity care. We know that maternal health is a focus of the state and also a challenge in rural parts of California. So for those of you who work specifically on maternity care or have partners who do, I would highly, highly encourage responses there as well. Okay, thank you. Ben, please, everyone, fill it out, share it, post it on LinkedIn, email it around. With our last couple minutes, and I see there's excitement in the chat around this, so we'll move quickly. There were some recent federal announcements around information blocking. So if we can jump to our info blocking section just to finish us up. And Olivia, I'll hand it over to you to share a little bit around what came out of HHS last week.
Sounds good. So yes, I'm sure many people saw that on September 3rd, HHS announced that they were going to be increasing resources and having a more active enforcement stance around information blocking of electronic health information. The Office of the Inspector General is the lead on doing the investigations, and ASTP and ONC have noted already that they are providing a supporting role in reviewing claims. ASTP and ONC has a report information blocking portal where you can submit claims of information blocking. And they also recently updated their FAQ, which does note that these reports can be anonymous. And a new update is that third-party submissions are permitted. So you are able to submit information blocking claims on behalf of another organization. I think on the next slide, we just wanted to call out, in addition to there being, more of a focus on information blocking at the federal level, there aren't new penalties or enforcement consequences that are coming along with this. So everything that has been established to date is what would be moving forward as a potential penalty or disincentive. And these have been established through prior final rules. focused on health IT developers, health information networks, and also health information exchanges, with a violation subject to up to a $1 million civil monetary penalty. And also certified health IT developers could have their certifications removed and from the ONC Health IT certification program. And then for healthcare providers, there have been disincentives that have been established, I believe, last year around participating in certain CMS programs, primarily focused on Medicare. For example, the Medicare Promoting Interoperability Program, the MIPS program, and then also the Medicare Shared Savings Program. So we have a slide here that outlines what these disincentives and penalties are. But we have a minute, so if there are any questions in particular, would be happy to address them right now.
I think
Uh,
oh, go ahead. Go ahead,
No,
Jonathan.
go ahead, Timmy.
I just am really excited to see that there's some movement coming out of on the federal side around information blocking. We asked that question. We've been asking that question for years now around how do we have more transparency? What's the feedback loop back to the state? How do we have more of a highway, if you will, back and forth so that we can actually do something here with any of the reporting? Hopefully, we'll stay close on this, and hopefully it is an opportunity for us to do more with ASTP to be able to kind of, block and tackle, no better way of saying it, of those bad actors.
So I just had I don't think we have enough time to talk about this right now, but it is an interesting topic in my world. Fire and EMS agencies are incumbent under this, which is interesting because certified health IT is not related to the information blocking rules. I actually thought it's a fascinating distinction in that the health information network rules do not reference certified health IT; they do elsewhere in the code. So there are 4 vendors in the EMS world that are subject to this. And yet there is very little awareness. I'm working kind of solo on trying to build awareness of that in my world. At the same time, we've been seeing folks like Brendan Keeler and others that I know folks here follow really talk about the need for examples. And I kind of wanted to get your thoughts on that, whether there is this question of, great, you put out a bulletin, but is anyone actually getting enforced?
Yeah, no, I think it's an area for sure that we will want to stay close and see where and how we can be of assistance. And we can follow up with you, Jonathan, as well, to help with that awareness. And we welcome
Awesome.
ideas on, practical solutions that we can do as a coalition.
Great, because there are some examples of that around the country. Again, EMS sort of playing catch up, but it's because they're subject to that. Some of them have been screaming about this type of work for years, and need to know they have a mechanism at their disposal. Thanks.
We're all ears. Yep. I know we're at the top of the hour, and I know we have a couple more slides here. Stephanie, do you want to walk through?
Sure. I think just to wrap up our upcoming events, we already briefly spoke about the Civitas one, but it's a busy, busy couple of weeks, and we're looking forward to seeing many of you in person. Olivia, you want to share briefly just around what's going on?
Yes, we'll be at Civitas soon. Looking forward to seeing people there. In addition to our coalition meetup on Sunday, we'll be having a booth. So you can come find us at booth 23. Additionally, if you will be at CAP and CHEAC, we are hosting additional coalition meetups. Please only RSVP if you are going to be there. Let me add these in the, oh, perfect, Maya. Thank you for getting those in the chat. So we're excited to have an after hours at CAP in partnership with Partners in Care, and then also to have a networking reception at CHEAC with Innovacer.
And again, please share this with your colleagues that will be there. Let them know that these meetups are, again, where the magic happens, right? This is where the networking happens. This is where we're able to continue to push forward our goals.
I think with that, we can go ahead and wrap up for today. As always, we have a number of interesting articles going out in our newsletter. Encourage you all to check those out. But we will see you all in 2 weeks. Our next meeting is 2 weeks from today. And I hope everyone has a great rest of your Thursday. Thanks for joining us.
Bye, everyone. See you soon.